thanks for staying with us. The number of COVID-19 cases globally have passed the 4 million mark. Here in South Africa, they account for 9,420 of those cases in terms of the latest statistics released by the Health Department. But let's take a closer look at those statistics and whether or not we are too fixated on it. I'm joined via Skype by Malan. She's the Executive Director and Editor of Bhekisisa Center for Health Journalism, who's been doing great work around the coronavirus. Mia, thanks so much for joining us. This week now, the Bhekisisa organization hosted a webinar with the now famous Abdul Karims, Professors Koresha and Salim, and always such a sobering conversation to have with them during times when we look at statistics. It's easy for us ordinary mere mortals to panic every time we see a spike. From your conversations with them, what do you glean from what we should be taking from these statistics? Do we just literally look at a statistic from day to day and say, well, there you have it, more than 500 cases more, it must be getting worse?
So in short, Michelle, no, you can't. So the big reason is that if you just look at the cases alone, they really don't tell us anything meaningful if you just look at them in isolation, because you need to look at them in relation to how many tests were done. So the number of positive tests is related to the number of tests conducted. So the more tests we do, the more positive cases we will have. And that's why you need to look at the two together. And we have consistently been increasing the number of tests that we've been doing over the past since the beginning, really, of our outbreak. So it was fine to have just looked at the number of tests at the beginning of our outbreak until the beginning of April, when the average number of tests per week were more or less the same. But after that, the number of tests per week started to change considerably. And why is this? It's because on April 7th, we started to send out community workers, thousands of them, into the field to look for people to test. So what that comes down to is that you can't compare apples with oranges. And what I mean with that is, before April 7th, we only tested people who went to the doctor because they felt sick, and scientists call this passive testing cases. And after that, when we started with the community health workers, we started to knock on people's doors. So let's say the ones that we have, just the sick people, are called apples. And what we now do is we have apples and oranges, because we have the sick people who go to the doctor and we have the people that we go to look for. So scientifically, it's not okay to compare apples with apples and oranges. You have to have a different way of looking at this. So you would now want to know what is better, right?
Yes, absolutely. And also in terms of our jobs at the media, because we've got readers, we've got viewers, we've got listeners who tune in during this time to find out what is the latest figure. It's almost like we're listening to it like a sports score, as it were. What would be a better way then about reporting on these numbers? Are we supposed to be looking at proportional percentages? How can we better report to the South African public on these numbers?
Yes, absolutely. So to compensate for the fact that we do more and more tests every day and that we have different ways of finding people now for tests, a better measure to look at is the percentage of tests that are positive. And if we look at that rate, which is round about 2.7% to 3%, that's been the rate sort of for the past, until about 2 weeks ago, that was the rate for the past 5 weeks, then we see, until recently, till about 2 weeks ago, the proportion of positive tests stayed more or less the same. There wasn't a significant increase in the rate of infections of our outbreak. But if you now look at the past week, for instance, we see that rate of just for this week is around about 3.7%. We're not complete. We still need today's figures. So it's starting to go up. And it is sort of expected, because we relaxed our lockdown regulations, which means there was more movement and which means it's easier for the virus to spread. So that is something that is expected. We can also look at how many tests do we need to do to find one positive case. And if we look at that, we needed to do around about 38 tests to find one positive cases until about three weeks ago. For this week, So far, the average is that we need to do about 27 tests to find one positive case, which tells you we now need to do fewer tests to find one positive case, which means they've become more common.
Now, you obviously also keep an eye on trends abroad, and a big case study that's been held up for everybody has been South Korea, and they went into mass testing. You were just speaking about the rate of testing. Now, the Abdul Karims are of the opinion that even though the NICD says they have the capacity to do 30,000 tests per day, like you've just mentioned there, that is not necessarily what we need right now. And a case scenario like in South Korea wouldn't necessarily just be able, we can't just take that and cut and paste and make it work here, because South Africa has its own intricacies and societal ebbs and flows that need to be taken into consideration.
Well, the lesson we've learned from South Korea is that, and the entire world has learned that if you go and do wide testing and find people in the community, that's a good thing. It's really only good if you have the ability to go and isolate those cases that you found so that they don't spread the virus. But what South Africa has, what is important to understand is you can't just have a blanket number of people that you need to aim for to test per day. It doesn't work like that. It works according to what is the number of tests you need to do to get a positive case. So, for instance, at the moment, we do 27 tests to find one positive case this past week. So that means we needed to start to increase the number of people that we tested compared to 3 weeks ago, because it's becoming more common now. You can't waste resources, you know, and if you, at the time when we needed to do like sort of 38 or 48 tests to find one positive case, the Abdul Karim said it's sort of okay to do between 10,000 and 12,000 tests per day, but you will only start to increase that when the rate of infection start to increase. Otherwise, you waste many, many tests. And as if you've heard this past week, this weekend, we now are struggling to find enough tests. The National Health Laboratory Service is struggling to procure tests because suppliers can't provide. So that is when we need to start to think really wisely about testing. Who do we test? So we'd rather want to go to hotspots and test people there, because the likelihood of transmission is far higher there than elsewhere. We might have to become a little bit smarter about who we test. And the interesting thing in South Africa is that the Western Cape, you know, has a much higher positivity rate than the average of the country at the moment.
Indeed, and something we're keeping a close eye on as well. Thank you so much. Always great speaking to you. Mia Malan is the Executive Director and Editor at Bhekisisa Centre for Health Journalism. Do go and check some of the work that they're doing, especially during this time when their speciality is all important.